Today I will be teaching Eric and his mom, Mrs. Lopez, about asthma. Eric is 7 years old and will be starting second grade very soon. Eric and his mom are of Latin American descent and have lived in the U.S. before Eric was born. They both speak and read English. Everyone in their household speaks English as well, with the exception of Eric's grandmother. We have interpreters on staff at all times if they are needed. Asthma is the most common chronic disease in children and can start at any age. I have had asthma since I was a child and continue to have it as an adult. Having an asthma attack can be very scary, but I'm going to teach you more about it today and how to manage it and live a normal, healthy life. I would like to start by explaining how asthma affects your body. Asthma affects the lungs, which allows us to be able to breathe. It causes the airway in your lungs to be puffed up and swollen. It also causes a buildup of mucus. Mucus is found in your nose, lungs, and intestines. We call mucus mocos in Spanish. The muscles around your airway also get tight, which makes your airway tubes even smaller and more narrow. Imagine if your airway is normally this size, where air can flow in and out easily. During an asthma attack, your airway is like the size of a straw, making it more difficult for air to flow in and out. This causes you to have symptoms of asthma, like coughing, wheezing, chest tightness, and being short of breath. There are certain things that can trigger an asthma attack: cold or hot weather, smoke, perfume, allergies, being around stuff you're allergic to like grass, mold, dust, or animals, and even running and playing. Try to find out what triggers your asthma. Mom, it would be a good idea for you to keep a record of this. Eric, do you have any indoor pets in your home? Does anyone at home smoke? The dander from your pet is what triggers your allergies and asthma. Common types of dogs that are safe for kids that have asthma are terriers, shih tzus, schnauzers, and poodles. My niece has asthma and she has a miniature schnauzer that stays indoors and even sleeps with her. If someone at home smokes, be sure to ask them to do so outside. Now let's talk about medications. There are two types of drugs used to treat asthma symptoms. Long-term controller medications are used every day to keep control of your asthma, and quick relief medications help reverse an acute attack. Your doctor has ordered Singulair, also known as Montelukast. This is a leukotriene receptor antagonist. This medicine blocks the action of leukotrienes, which are released during allergic and inflammatory reaction. Singulair will help prevent asthma attacks. It is important to remember not to take this medicine to treat an attack, only for prevention. Singulair is safe for children 6 months and older. Eric will be taking 5 milligram chewable tablets for children once a day in the evening. He can take this medicine 1 hour before he eats or 2 hours afterwards. This medicine should be taken every day, even if Eric does not have symptoms. Do not stop taking this medication without permission from your doctor. Common side effects are headache, diarrhea, stomach pain, rash, or feeling thirsty. Please let your doctor know if Eric experiences any of these symptoms. Eric will also need a quick relief medication to relieve acute asthma symptoms. He will be using albuterol, an inhaled bronchodilator, also known as Ventolin HFA. This is used in patients 4 years and older that have reversible obstructive airway disease. Albuterol is a short-acting beta-2 agonist bronchodilator and works by relaxing the smooth muscles in the airways from the inside of your throat all the way to your lungs. The dosage is 2 inhalations every 4 to 6 hours. If Eric needs to use the inhaler more often, you need to visit with your doctor. If symptoms are not relieved with the use of the inhaler, seek medical attention immediately. Common side effects are sore throat, cough, fast heart rate, heart pounding, shakiness, or dizziness. Please notify Eric's doctor if he has any of these symptoms. After using my inhaler, it makes me a little shaky, but it goes away pretty quickly. I want to go over an asthma action plan with both of you. We will use stoplight colors to determine the level of Eric's symptoms. Green means Eric is doing well and he has no asthma symptoms. Continue regular activities and medications. Yellow indicates Eric's lungs are somewhat narrowed and he is having difficulty breathing. He will need to use his inhaler. Red is a sign that Eric is having great difficulty breathing. Eric should use his inhaler and seek medical attention. If Eric's symptoms are not relieved with medication, he needs to seek medical attention immediately. Severe asthma can cause respiratory failure and even death. It is a good idea for Eric to wear a medical identification bracelet or necklace. Does Eric use any over-the-counter or herbal or folk medications at home? We want to make sure he's not taking anything that would interfere with these medications. We will be giving Eric a prescription for the Singulair tablets and the inhaler. We will have called in prescription for 2 inhalers so Mom can keep one in her purse at all times and one at home. We will try these medications and see how they work for Eric and make changes as needed. Please be sure to call if you have any questions or if problems come up. We have also provided written instructions of everything we covered today in English. Do you need them in Spanish as well for your grandmother? I have provided the number to our local asthma program to help offer support for Eric and your family. When registering Eric for school, please be sure to inform the school nurse about Eric's asthma medications and routine. I will be happy to speak to the nurse as well. I have also included the number to our social services department and a prescription assistance program in case that is needed. Will you need any further support for religious, spiritual, or financial purposes? We will now take time to demonstrate how to use the inhaler and spacer, and I will have you and Eric do a return demonstration. First, shake the inhaler 3 to 4 times before using. Remove the cap from your inhaler, put the inhaler into the spacer, breathe out away from the spacer, put the spacer mouthpiece between your teeth and close your lips around it. Push down the top of your inhaler 1 time. Breathe slowly in, take a full breath, hold your breath for 10 seconds if you can, and then breathe out and repeat 1 more time. I will now have Eric demonstrate to make sure he's able to do this. And if there are no other questions, I know there was a lot of information provided today. Thank you very much.